So I've already discussed in this video that yes, you can actually work while you're in nursing school. Now, if you're wondering, well, what would be some good jobs for a nursing student? Stay tuned because I'm going to answer that question in this video. Hey, this is Thomas from Nurse Money Talk, where I help nursing students become nurses and nurses excel in their nurse career and nurse life. And like I've already mentioned before, let's talk about some good jobs for nursing students. Before I get started, let me go ahead and invite you that if you find this video helpful, don't forget to hit that thumbs up and that subscribe button. Plus, any jobs that I do mention here, you can go to nursemoneytalk.com/job to apply and see which one of those jobs will be available in your area. Let's go ahead and get started. The first one is a phlebotomist. Now, a phlebotomist is, in a nutshell, it's a medical worker that collects blood samples to run in a lab. This one I think would actually be kind of interesting in terms of being able to hone in a skill sets that I think a lot of nurses struggle in, I would say a lot of them struggle in, which is being able to get like blood draws in general. So you'd be trained, you'll kind of be able to hone those skills in before you actually go out there and become licensed as a nurse. It looks like they make roughly about $13 to like $17, $18 an hour. So definitely not a bad gig. Next one is a hospital transporter. And I think this one's like fairly self-explanatory. You're going to be transporting a patient from one place to the other. I've worked at facilities where a patient needs to go down for X-ray or whatever the case is. You just call the hospital transporter. The hospital transporter will come, take them down there, and then bring them back. This is typically in once you start getting to more acute patients, so like patients in the ICU and whatnot, patients that require, constant monitoring, then typically you need like a licensed professional, like, a nurse with them. So a hospital transport typically can't transport those patients. But the nice thing about a hospital transporter, especially if you end up going and working at the hospital you want to work at as a nurse, is that you'll get to learn where all this stuff is at. Like, I don't know about you, I am horrendous when it comes to directions. Not even so much directions, like even knowing where stuff is at. Like the hospital where I've been at now for I don't know how many years, I'll have patients ask me, do you know where X, Y, and Z is? And I'll be like, no, but I can go find somebody who does. And so it'd be really nice. So like if I worked as a transporter at this facility before coming in, then I would know where all those places are at, because I've probably been all over the hospital. And I think it's fairly normal as a nurse, or even, if you're not a nurse, whatever profession you're working at a hospital, that your little bubble. So where you have to go to for the specific things that you do on your unit. But outside of that, no, not so much. So hospital transporter would be pretty good for that. Potentially looking at about $9 to about $16 an hour, just kind of depending. So next one is a home health aide, and a home health aide makes roughly about $9 to about $12 an hour. And they pretty much work under a licensed nurse to provide care to basic care to a patient who's home, so for whatever reason, they're not coming to the facility, so you're going in there and providing some support as well. Next one is a dietary aide. And so this one makes about $8 to about $13 an hour. And so pretty much you're just preparing food. Of course, you're preparing food, especially if you're working in a hospital. You're probably preparing food to very strict dietary standards or requirements as well. So kind of gets you familiar with some of that as well, because sometimes I think that when you're talking about like nutrition, that sometimes it's not mentioned enough. when it comes to just kind of like how important when you're looking at overall nutrition and food intake, or being in a facility, and kind of like the work we do in terms of promoting patient health. Next one is a psychiatric aide. And I'm also gonna pull in the other one as well, which is a nursing assistant or nurse aide. Kind of similar in the sense of like, one, the psychiatric aide is focused primarily with patients who work in mental health facilities. And the nurse aide, nursing assistant, you're probably gonna be looking at them in just about everywhere else. I've worked in mental health facilities, and we've had, I worked at one where it was actually in a hospital, and so you would have nursing assistants that would kind of float sometimes back and forth from other units, from non-mental health units, so medical floors and whatnot. I think they required some special training to be able to float to the, yeah, they did require some special training, now I'm thinking about it, to be able to float. But you can kind of see at times, depending on the facility, those can be interchangeable, depending. Doesn't mean it's necessarily always a good thing, because there's different skill sets that are needed when it comes to dealing with patients in a mental health facility. And then, of course, with dealing with patients in a medical floor, actually those skill sets don't rarely mix together, even though facilities do sometimes try to mix them. So as for pay wise, it really just kind of depends. So you could be looking at anywhere from $10 to about $19 an hour, just kind of depending. From what I've seen, it looks like the mental health aides generally tend to make a little bit more money. I've always found it interesting, observing and seeing nurses who have worked as techs or aides before becoming a nurse versus the nurses who haven't. Like, they haven't really worked in a hospital, haven't really worked as an aide. And I guess one of the things that I've noticed is I feel like the nurses who have worked as aides and then became nurses, they tend to have a little bit more of an appreciation for their nurse aides than those who didn't work as an aide before. So before I keep going on, I do want to bring up a couple of points. One is that pay, of course, is going to vary depending on depending on your state, depending on what city you're in, even within that state, or you're in an urban or rural area. So of course, pay is going to vary with that. Second thing as well to notice that some of these jobs will require potentially some training to be able to do those jobs, depending on the facility and what state you're in. At times, you being a nursing student can help facilitate some of that. And so that's just kind of some things to keep in mind as well as you're looking into this and you're seeing some of the stuff I'm bringing up. It's like, wait, doesn't that require a little bit further training? Well, keep in mind though that you are in training, you are in nursing school. So I would definitely, like, whatever facility, like I said, the state you're in, the facility that you want to go work at, I'd probably, do your due diligence, reach out to somebody, in HR, hiring or whatever, and just kind of have that conversation with them. Because one thing that you realize as well is that a lot of these hospitals, they will, it might be a bit much to say bend over backwards or something like that, but I mean, they will definitely put in a lot of effort to try to recruit you to come and work, especially, when they know, and this is when they know that you are a nursing student. And then, because their goal is to hopefully they get you to come in, you'll work, they'll support you, if you will, through, through nursing school. And then hopefully when you're done there, then you'll just transition over and work at their facility as a nurse. So next one is an EMT, or an emergency medical technician. So don't confuse this with a paramedic. But this is somebody else who would be considered first responder. They're first to the scene. So a couple of things with this job is that you'll see that they're actually paid probably one of the highest that I have on this list at about $16, $17 all the way up to north of $20 an hour. And, so if you think about it, a little bit further training is needed. I've seen some EMTs who then went on to get their nursing degrees. So I think this probably lends itself a little bit better if you are already a nurse. Or sorry, if you were already an EMT and then you're going into nursing. And then the thing about it is that I've also seen that EMTs will also work in the ER as well. So some ERs I've seen will hire EMTs over there. They're first responders. Their goal is to stabilize the patients, assess, the patient's health conditions, provide and perform first aid, CPR, dress wounds, provide oxygen, especially like if they're actually out on the field. Something to keep in mind as well, I think it's one of those things where this would be really great depending on what you have going on. Next one is looking at orderlies. They make about $9 to $17 an hour, just kind of depending. And these are the ones that are cleaning and sanitizing rooms, tools, equipments. So anything of that nature as well. I think depending on what they're doing, I think they're one of those, one of those healthcare workers who, like, if you're a nurse, you might not have a whole lot of contact with them. So it just kind of really depending. So, I work in GI. So of course with our scopes and everything else that we're using right now. So, I'm having to take that over to, I don't think my facility calls them orderlies. I think they call them something else, but either way, job, kind of like a lot of their job description would fit right around this. So I would probably, like, if you are looking for this job as well, so the facility might not call them orderly. So just kind of keep that in mind. And as well, I'll put in the link below to an article that I wrote about this topic that will go into a little bit more details on each one of these jobs. There's actually 3 more positions that I'm gonna mention. One is a scrub tech. It definitely requires some extra training as well with this. And I remember they did work throughout nursing school as well, and they get paid really, really well. Actually, I did not write this one down, but I'm gonna look that up real quick. So they're making about north of $23 an hour. So, I mean, that's not of course there's training, extra training that's involved in it. But once again, depending on your situation and what you have going on, if you are already a scrub tech, this one would be a pretty good one as well. Next one would be an undergraduate tutor. I worked as a undergraduate TA, if you will, or lab tutor in the nursing program where I was at. But this is not just even restricted specifically to nursing as well. Like if you're coming from I was also an undergraduate tutor for, what was it? It was human physiology. I was an undergraduate tutor for. So these are really great positions to be at because one, they tend to be, they're low stress. It's something that you've already have done. So you're kind of you're already very familiar with it as well. It's a very familiar environment. It's it's probably on campus. So getting to and from, school, work, or if you live on campus or whatever, it could all just be within walking distance. So definitely not a bad gig, depending on what you're doing as well. You could also have situations where you are on the clock and you get to study as well. And so I would honestly lump any on-campus job as well that gives you an opportunity to study. Yes, that's actually going to be my next one as well, is any on-campus job that allows you that's low stress, works with you, which on campus, a lot of on-campus jobs will work with your schedule, and will allow you to, if there's nothing going on, will allow you to study while you're on the clock. And so for these jobs in general, pay is honestly can be all over the place, you know, maybe $10, $12 an hour, maybe a little bit more than that. But at times the value in this is not necessarily the pay itself, which that helps, but it's also in it's low stress. I get to make some money and opportunities to where I'm working and getting paid as well. So definitely keep those jobs in mind. Last one I'm going to mention, and that's just because I know some people who did work in this when while they were going through school, and that's being a waiter or waitress in a restaurant, which similar to the other job that similar to kind of like the undergraduate tutor as well, in the sense of like it can work around your schedule potentially pretty well. I think there's, the people I know that have worked with waiter or waitresses, the managers tend to be pretty accommodating to what their schedules were. You can make pretty good money as well as a waiter or waitress. This says like $11 an hour, but I mean, honestly, like I wanted kind of like an official one from an official kind of like average pay from the U.S. Bureau of Labor Statistics. But I mean, that's just really low pay compared to the waiters and waitresses that I've talked to who are making a lot more than that. And then if you end up doing bartending as well, like the amount of money that you're making is even higher than that. Once again, not healthcare related, but if you need money, you need the money as well. If it works around your schedule, there's that as well. Of course, when you're doing, like waiter, waitresses, if you're looking at bartending or anything like that, there's a customer service aspect related to it, being able to communicate, deal with people in very interesting situations and mindsets, if you will, and being able to handle that professionally as well, I think lends itself pretty well to just being able to allow you to finish nursing school. So that's pretty much it for my list. But I'm curious, is there any other jobs that I should have included? But I'm kind of curious. Let me know in the comment section below if there's other jobs that you think that I should have included on this list. If you have any questions on top of that as well, also let me know in the comment sections below. Thank you so much for watching this video, and I will catch you very soon in that next video.